Hello, my name is Michael Iwama, and I am Chair and Professor of the Department of Occupational Therapy at Georgia Regents University. And it is my special honor today to be able to spend a few moments answering some questions that have been given to me by the great students of occupational therapy at ETOS, the Occupational Therapy School of Osnabruck. I want to say a special hello, of course, to my very good friend and colleague, Ms. Imke Winkelman, who I love dearly, and we've been good friends for so many years. It is such a pleasure to be able to be involved in her class today, and it's just wonderful to be able to have this opportunity to connect internationally and to share these ideas across the Atlantic Ocean. So without any delay, let me just get into trying to answer the questions that you have given to me. These are all wonderful questions, and I think that there were 17 questions in all, but I've elected to just go through perhaps 5 or 6 of these questions because I think that some of the answers and some of these questions are quite related. So by answering some of the questions, I may actually be giving answers for quite a number of the questions that you've put forward to me. And if I don't cover something and you really want to know an answer to a particular question, please forward your question to me again through Imke, and I'll be very happy to be able to answer them to the best of my knowledge. I hope that I speak English slowly enough for you to understand what I am saying, because my ability to speak Deutsch is very limited. So please pardon me for not being able to give this to you in your native language. The first question that was put forward to me about the Kawa model is, number 1, can you please tell us something about the underlying theory, the Eastern perspective? Yes, absolutely. The Eastern perspective of life in general, of the universe, the relationship between the self and the universe and the environment, I believe differs very much from the way that you might see things in your philosophy in your part of Europe, your part of Germany. I want to just say that the basic view of how Japanese people view life and view the self and view the nature and the environment is very similar to the way that many of the so-called primitive people of the world also view the world. And I'm speaking specifically to the peoples of the world, for example, the Salmi people of northern Finland and Sweden, as well as the Maori people of New Zealand, the Aborigine of Australia, the Mapuche people of South America in the area of the world that we know as Chile, as well as the First Nations people of Canada, or often referred to as the American Indian of North America. All of these different peoples, and I believe also many people of the African continent, share a particular view or philosophy of reality, the cosmos, the world, the self, the universe, and so on, that differs quite a bit from how many Westerners or people in Western Europe have come to know and understand the world around them. The basic difference, if we look at the more old primitive view of the world, is one in which the concept of the self and the environment are instead of being two separate entities as they are in the Western world, the self and the environment, the spiritual world, the sea, the sky, the mountains, the ocean, people, animals, insects, snakes, bugs, trees, living and dead trees, all of this matter are all connected together in one inseparable whole. Okay, so everything is dependent on each other, and although everything is in flux or um, in a dynamic kind of movement and adjustment, uh, everything is all together in one connected whole. Um, Much of the writing that you come across in Buddhism as well as in Hinduism also speak of a similar view of reality in the world where everything is connected together. It was in Western philosophy that we begin to see the rationalization of our views of reality in the world. That is, that instead of everything all jumbled together and mixed together in one inseparable whole, that we see a logical separation of all of these different parts. And so, for example, there is a tendency for people in the Western world to hold a philosophical view that all things in the world around us, including ourselves, are made up of many, many, many different smaller parts. And all of these parts all fit together in a logical format. Um, and we don't just do that about people and objects in the world, but also with regard to environments and space around us, as well as another dimension, and that is a dimension of time. I have to laugh a little bit when I think about my answer to this, because I remember the first time that Imke Winkelmann uh, uh, welcomed me to Germany and gave me instructions on how to get to Osnabruck from wherever it was that I was traveling from Frankfurt, I believe, from the airport. And I had to ride on the various trains on the Deutsche Bahn. And before I came to Germany, I learned that Germans are the world champions of rational thinking, that everything is very organized, everything is put together so very logically and efficiently and effectively. That's what Germany is famous for. At least that is a reputation that you have. There's also an expectation that your Deutsche Bahn system also runs exactly on time. And very much like your classrooms and the meetings that you have in Germany, where everything starts right at the time that it's supposed to. And I was astonished to find that the first train that I got on in Germany was actually late. So, not very German, the Deutsche Bahn. Okay? I hope that's enough to give you some ideas about the differences in the Eastern perspective. The Eastern perspective is that all things in the world and in the universe, including humans and animals, rocks and trees and air and so on, everything is connected together in a very complex, fluid whole. That when parts of it change, so does everything else. And it's in the rational part of the world, like in Germany and America and so on, especially in countries that have been affected greatly by the Judeo-Christian religions, that we see a separation of all of the elements, so that we have God Almighty at the top, and then we have me, myself, next, and then we have everybody else, all of the other human beings, and then at the very bottom is nature, that has been given to us for our use and our pleasure, and that we're supposed to take care of the world as well, which is something that we don't do very well. But that's the basic difference in the way that the philosophical view of reality. Number two, why especially the river? Was there a particular inspiration Why the change from the schematic original diagram to the metaphorical view? Very good question. Well, most theory that we encounter in the world today in the fields of science and even occupational therapy have been greatly influenced by that rational, Western, logical view of the world. In fact, it's the scientific world that gave us theories. And theories are supposed to be really quite logical representations or explanations of complex phenomena. And so the progression of A plus B plus C equals D in a straight line is kind of like the format of what we call linear theory in science as well as in occupational therapy. And many of our models in occupational therapy that are familiar with us, to us, such as the PEO model or MOHO or the Canadian model of occupational performance, they're all made up of discrete concepts that are sometimes depicted by boxes or circles and are connected together, and there is either an implied or explicit use of arrows or some kind of progression to show the relationship between all of the different parts. Well, when I first went about trying to build a new model of occupational therapy, we wanted to build a model that resonated with, or in other words, the local people, ordinary people, not therapists, not scientists, not scholars in the university, ordinary people in everyday life could understand this new model that we were trying to develop. So when I first started developing the Kawa model, I thought we should make things into boxes in the same way that I understood models when I lived in Canada and worked as an occupational therapist there. But given that the Japanese Eastern philosophical view of the world is one in which all things are connected and things are fluid, and where one thing, one change in one part of the system affects the entire system, the initial model or schematic that we came up with, as you can see, is very much reflective of that kind of thinking. Boxes inside of a circle, connected together by arrows going in all kinds of different directions. So one of the Japanese colleagues that I was working with, they were all clinicians or practitioners of occupational therapy, they said, this is too difficult to understand with the boxes and things. It's not good enough. It doesn't mean very much to me or my clients in Japan. So there was a popular song in Japan at the time, sung by a very famous diva who is now passed away from old age. Her name was Misora Hibari, and she sings a classic song. The name of the song is called As the River Flows. In Japanese, it's known as Kawa no Nagare no Yoni. Kawa meaning it's the Japanese word for river or flus in your language. And this song was about the life journey. It's a song about an elderly woman who, before she dies, she follows the footsteps up the path along a river back to her place of birth. And as she goes along the river, she reminisces and thinks about all of the good times and the bad times, the trials and tribulations, as well as the triumphs in life, and metaphorically speaks about this. It's a very popular song in Japan. It's one that most people know, especially middle-aged people and older people for sure. And she said, one of my colleagues said to me, we can explain this model in a better way that makes sense to a lot of Japanese people, and that is in the metaphorical pattern of a river. A river is one in which if we take a cross section, you will see that there is no distinct concept for the person, but rather it's made up of river walls and sides that determine the basic flow of water, which is symbolic of life. And the river walls can constrain and come apart, as you know. There are rocks and driftwood that appear in the river, but the whole thing is depicting the self, and the whole thing is depicting the context as well. All of these elements are connected. You change one element, you drop a big rock in the middle of the river, and it changes the flow, and it changes the river. It's not the same as it was before. So that's why the river metaphor was used. Now let me just say that if the river metaphor does not work for your client, consider putting it aside and choosing a better model to use, or even a better metaphor. I remember once a German young man, a student of occupational therapy, suggested that instead of the Fluss Model, it should be the Autobahn model. Instead of life being like a river, I guess as a 21-year-old young German male with lots of testosterone flowing through his body, that he thought life is not like a river, it's like a superhighway without any speed limitations. And like life, there are slowdowns and traffic jams, and there are times when the traffic will go very, very quickly and a crash will result. Such is life. There are on-ramps and off-ramps and so on and so forth. So that's something to keep in mind. It will help you to determine when the river metaphor is the best one to use and when it isn't. I use it as a starting point in my interactions with clients, and it is a nice way to begin to get an idea of what it is that that is going on in the client's life in a way and in words that I as a therapist can understand. And in turn, I can use that same river metaphor to also communicate to the client in a way that the client can also understand. So think about this. The river metaphor is actually a vehicle of understanding and communication that goes back and forth between you and the therapist. In the middle is this metaphor of a river, and we use it first to try to understand and appreciate as best as we can what the client's experience of everyday life is like. And once we identify what those issues are, then the occupational therapist can use their skills and their knowledge in a way that is going to help that person in a way that makes sense with them, that resonates with their reality. Okay. Number 3, where do you see the advantages, opportunities, characteristics, particularity, etc. of the Kawa model? Well, I don't know whether I understand this question very well, but I'm going to just let you know that what I think is really remarkable in the advantages of the Cowell model is that it's a model that differs dramatically from the models that we have in occupational therapy. You know, the models in occupational therapy are really frameworks that the theorist who made the model imagines what normal should be. So they think of the concepts and the principles that connect the concepts together, and then they turn around and they superimpose that onto the client. They hear the client's reports of their difficulties in everyday life, and then it gets filtered through these sophisticated concepts like occupation and volition and habituation and so on and so forth. These concepts, these words are not the client's words. They belong to the people who made those concepts, the theorist in the university in America or in Canada. And the person's story gets filtered through these concepts and gets changed so profoundly and dramatically that if we were to take what we wrote about the client using these existing models and these concepts like volition and habituation and personal causation, that if we were to then give that back to the client, I think that those clients would not even understand that that is their story. So here is the essence of the Kawa model for you. If there's anything that I want you to understand about its advantages, I want you to think about it this way. Think about, with the Kawa model, the client, the patient, uses the metaphor of a river to build a unique model or theory that explains their reality of everyday life, their experience of everyday life, how their life is going, how the river is flowing. And the therapist becomes a student of the client's model and asks questions. Why did you put this rock in here like this? Why is it so big? Shouldn't it be a little bit smaller? Why are the walls so tight like this in this area? And engages in a conversation in which the client tells them what is really going on, so that there's some agreement that occurs. The therapist, who is the student of the client's model, is verifying, is wanting to really learn the client's model. And then once that is done, both student and theorist can sit down together and collaborate and look for ways to solve those problems, to find ways to allow that person's river to flow better, to flow more powerfully, to flow more beautifully than it was flowing before. Okay, so there's no other model quite like the Cowell model. And I think that it's a very nice way to get a very holistic view of the client in the context of their environment and their realities in everyday life. And that is what we should base our occupational therapy on. Not just come into the patient's life and say, here, I know everything because I'm the professional. I've been to ETOS for 4 or 5 years, and I've learned to become an occupational therapist. So I know your experience and reality of everyday life better than you know it yourself. Isn't that so funny and so laughable? But that is exactly what happens when many OTs try to use theory that has been built in someone else's reality and then superimposed onto the client. This is the reason why the Kawa model is being understood in so many places around the world. It's taught in more than 500 OT schools, and it's being used across 6 continents. So even though Germany is a little bit behind, you're one of the leading programs in occupational therapy in Germany, because your teacher is astute enough and sharp enough to be able to give you a model that is at the cutting edge of theory development in occupational therapy today, which is the Cowell model. Okay, on to question 4. Are there limitations to apply the Cowell model? For example, when clients cannot speak for themselves? Another excellent question. You know, I don't want you to think about the Cowell model as just another model in occupational therapy that assumes that it is universally applicable to everybody, that there's somehow some kind of correct way to use it. No. I want you to learn the Kawa model in such a way that you can make decisions to change it, to make it work for you and your client. The ultimate goal is to try to find out how the client is experiencing everyday life and how they view reality. Um, and so I want you to, um, you know, make good decisions about how models are used in occupational therapy, and and that means being able to take something like the Cowell model and understanding that there is no one correct way to use it. Explore ways in which it will work with the German population. Now, getting back to answering your question, what do you do in situations when the client is an elderly person with dementia, with Alzheimer's disease? Or what about for that young child who has profound disabilities or is so young that they don't even have language capabilities to be able to express themselves? What do we do in such cases? Is the Cowell model useful? Well, occupational therapists around the world are beginning to become more and more familiar with something called family-centered occupational therapy. But I would go beyond family-centered and I would ask the question, does the client have to be just the one person? If we're looking at it from an American or North American point of view, some of us would agree it has to be the one person. That's what this is all about. It's about, the individual. But I say, for that person who has dementia or can't speak for themselves, what is wrong with gathering their loved ones together, be it close friends or others, if the person doesn't have an immediate family or does not have support from their family? Or why not gather family members or the person's husband or wife or brothers and sisters, and to be able to collectively, using the Kawa model, have a conversation, a helpful conversation, to look for ways in which we can try to understand, try to imagine how that river is like for their loved one. And then for the family, with the help of the occupational therapist, to try to find ways to collectively problem solve, to find ways for that river to flow more effectively. So I guess what I'm saying is that I don't think that there are limitations with regard to instances where the person cannot speak for themselves. And I encourage the person who asked this question to think about ways, to innovate ways in which we can find ways to modify the Cowell model so that it can be used for people who don't have the sophisticated skills of being able to express their thinking and their wants and their needs and their perspectives through either written word or spoken word. Okay. Question number 9. Is there further development of the Cowell model? Yes, there is development going on all the time, and it's being done by clinicians all over the world. But unfortunately, clinicians and practitioners, of course, are not necessarily scientists and researchers and people who write papers and regularly publish their findings. So the development of the Cowell model is happening at a very grassroots kind of level, very fundamental. I'm seeing it increasingly in many, many, many different bachelor's and master's dissertations and thesis writing around the world. It's happening in Asia, it's happening in Europe, it's happening for sure in the UK, in Canada, as well as in the United States, and also in South America, and as far down as South Africa on the African continent. So I can say with confidence that there's further development. But what I want to also tell you is that what I am doing now is I'm working with a department in our university to develop some what we call apps. That is the next step that I want to innovate for the Kawa model. I want there to be apps that we're developing two of them. Right now we're developing one that runs on a smartphone, and we want to build one for the general public, not just for OTs or OT students, but one that the general public all over the world can use in a fun kind of way, in which they use the river metaphor to describe how they're doing, how their day is going. And we want some animated backgrounds that depict the great rivers of the world. For example, maybe we will have the Amazon River of South America, the Mississippi River of America. It may be the Yangtze River in Asia. Maybe in Africa it will be the Nile River or the Zambezi. Maybe perhaps in Europe it'll be the Duna or the Danube River in your part of the world. Whatever the case, a person will be able to insert rocks, expand the size of the rocks, to be able to play with driftwood and the river walls and sides to expand and make them smaller. And it will be kind of a fun way. You can then save your drawings in perhaps a PDF format that you can refer back to and compare from time to time. And the other thing that I like about it is that we want to build in a social media dimension to it. So maybe through Facebook, people will be able to post their rivers online and be able to share with others. Or they can use it privately to look at how they might problem solve, to see how they can get their day going better, how they might work on some rocks to make them smaller, or how they might do something in the social environment to expand the walls of the river to allow greater flow to happen. Or maybe it can be done with friends, where you can share your problems and say, I wonder what I can do about this situation, this big rock that is in the middle of my river. And then we want to build, of course, another app that will be version 2 of this, and it will be more specifically for occupational therapists to run on tablets, iPads, and things like that, where it will be much more sophisticated. It will probably tap into a database, perhaps into a cloud, so that the sharing of files and case studies across the world can happen in real time. So that's how we're thinking. There's always innovation happening with this innovative model. So those are some secrets that I shared with you, but we hope that these apps are going to be ready for the World Federation of Occupational Therapy Congress in Yokohama, Japan this coming June. So sometime before then, hopefully, these will be ready and they will be done in time. So watch the internet. Please go to the Facebook page, the Kawa Model Facebook page, or go to Michael Iwama on Facebook and find out what is happening in the world of the Kawa Model. Okay, so the last question is number 17. What turns the Cowell model into an OT model? Such a great question. What makes this metaphor useful in occupational therapies? Well, you'll notice that the Cowell model itself does not have a concept called occupation. In fact, it doesn't even have a concept for the self. But I want to answer this question in a kind of obvious and simple but powerful way. The Cowell model turns into an occupational therapy model when it's used for the purpose of occupational therapy in helping a person's daily life to go better, to flow better. So when we think about what we're trying to do in occupational therapy, well, I think that occupational therapy is about helping ordinary people from all walks of life to engage and participate in activities and processes that have meaning and value to the person. So I guess what I'm trying to say is that if you can use the Kawa metaphor for the purpose of being able to really try to understand the person's story of their everyday life, and you can then use your knowledge and your skills to then be able to help that person's river or life to go better or to flow better, that's occupational therapy. And in that instance, the Cowell model becomes a model of occupational therapy. Okay, so that's all the time that I have to share with you, unfortunately. I only have 40 minutes or so for the making of this video. I want to wish you good luck. I'm excited about the fact that you're going to become occupational therapists. I think you have one of the best teachers in the world teaching your class, and that is Frau Imke Winkelmann. And I respect her greatly. I look up to her. I'm a real big fan of hers. And it's always a privilege to be able to come into her classroom and to share ideas with her students. So thank you very much, Imke. Thank you to all of your students. And I look forward to the next time that I can go to Germany, and more specifically to Osnabruck, and to be able to enjoy meeting you and sharing ideas with you all again. Okay, so these are not answers to all of your questions, but I hope that it's a start in getting you to understand what the essence is of the Kawa model, and that it will help you to ultimately become good occupational therapists. The Kawa model, I'm sure, in the future will be superseded by other new models that come into our field. But at the present time, it's a very different kind of model, and I think that it's one that many, many occupational therapists around the world are finding a way to appreciate and to use effectively in their practices. This is a great profession. It's full of great people, and that includes all of you at ETOS. So, with that, I say Dankeschön, and thank you so much. And maybe the way to say goodbye is just to say Tschüss. Okay, bye for now.